All right, we are live. Hello, everybody. Hello, Dr. Maggie. How are you? You guys,
Good.
good. At the end, we're going to have we have these great commercials that feature people like Dr. Maggie and all of our past speakers. So we do want to make sure you see that. So afterwards, just hang tight for a little bit, and you'll get to see those commercials that we all worked so hard on. So, Dr. Maggie, how are you?
I'm great. It's a new year.
Yes, it is.
We,
It's gonna be
we,
something.
we had a tough day yesterday, but today's a new day.
Absolutely. Now, let's talk a little bit about yesterday, because I feel like if we just go into our conversation, we're kind of ignoring the elephant in the room, and I hate ignoring elephants in the room.
Absolutely.
All
Yeah.
right. So, what were your thoughts on yesterday?
I was really disappointed. It was a really, really sad day, I think, for America. It exposed, again, like the past year, so many issues that the country does have with racism. And it really did expose the belief that sometimes, we really do feel like we're living in two Americas.
Mm-hmm.
There are rules for certain groups of people and rules for other groups of people. And to see the violence and the hatred storm the Capitol, especially on the day where there was achievement in Georgia, really saddened me. And it really made me feel disheartened by the fact that I have a child, and I wondered, is this the America that my child's going to see?
Mm-hmm. Yeah.
So it was tough, and it's been lingering all day, with me, my colleagues, again, with all the advancements of like the COVID vaccine and obviously the election results and yesterday's results and Stacey Abrams, really miraculous and really determined efforts to kind of end the day on such a sour note and such a really bleak note, really, really, I think, crushed a lot of spirits.
It absolutely did. And I got up so excited. I was so excited. I was like promoting it on all of our social media, and I was just too excited. And then it just went like downhill so fast. And yeah. But now my question to you, because I think sometimes we look at the world as we look at it as Black people, but people like, what I think people might be misunderstanding is, why is racism a part of this equation? They stormed the Capitol. Why is racism a part of this equation? Because I feel like there's always going to be those people that like are ignorant in regards to, what does this have to do with each other?
It really, again, did expose a lot about how, African Americans, Black communities, brown communities, minorities in general do see the country, and why we are sometimes so hurt and disappointed and disheartened. Because there was a picture that I saw of the security guards in front of some structures in DC when there were Black Lives Matter protests, which were for the most part peaceful. And when things did start to get rowdy in certain, areas of the country, the leaders did speak up and try to quell any type of disruption. And to see that picture of the, security for the Black Lives Matter movement, and then to look at yesterday's picture of no security, just mayhem at the Capitol, it really did put a spotlight again as to, we are living in two different Americas.
Yeah. And it's almost like that there was no threat there. There was no threat there. So why do we even need to call the police? We don't even need to call the police. We're fine. But, we heard that there were going to be, we heard that the BLM movement, the Black movement, is going to protest here. So we better have the National Guard. But Absolutely. We heard that there is a Trump group protesting, and we're good. We're good.
Absolutely.
We'll let no one come.
Absolutely. I mean, there's just so many striking pictures. If you really look at last year after George Floyd and Breonna Taylor and all of those pictures with the intense security, when, most of these protests were peaceful, and to see almost no security or a security breach at some point, and the allowance of all these protesters and supporters of Trump, and it really, really struck a chord. I know in me and in a lot of my colleagues, and I think you can't really say much after you look at both pictures. And I think now you can understand the perspectives from the minority communities. And again, it really speaks to what kind of America are our children growing up in. When children look at these sites, what kind of message does this send to them?
Yeah. And I was in a chat yesterday, and a doctor was asking, what does she tell her kids? And her kids are, number one, they were like, well, how old are your kids? Because that makes a difference. What we tell our kids, how old they are. And I was thinking to myself, I don't know if it does. I don't know if our kids get the luxury of not knowing stuff at 6. I don't know. I don't know. But what they were basically going towards was that tell her there are bullies in the world and that people are mean and da-da-da-da. And they were really skating past racism and the systemic racism that has been weaponized with our police force.
Yes, obviously it does.
It's almost like it makes people who don't experience racism, it makes white folks uncomfortable, and Asians in some communities and Latinos in some, it makes them uncomfortable, and Indians to even for Black folks to even acknowledge that racism is a part of it. It makes them uncomfortable. It makes them uncomfortable.
Yeah, but it's the reality. It really is the reality. And unfortunately, I agree, you have to be sensitive with children, especially young children, but I don't think you can shield them because it is a part of life. And unfortunately, there is color. People do see color, and
they'll get hurt.
It hurts. And like you said, you do have to speak to your children about being bullies, being able to understand each other. And you may disagree, but again, not resorting to violent acts, violent words. Like President-elect Biden said, your words do matter. And especially the words of a president, a leader of the free world, does matter. Absolutely. To how people act. So
absolutely,
it's going to be interesting to see how things fold out. But again, I was up late watching the Congress session, and I was happy to see, at least after 3 a.m., that for the most part, Congress did come together. And maybe this event had to happen in order for some of the leaders in the Republican Party to really certify the election results without as much resistance. Because I think it really did strike a chord in everyone. And, violence does not solve anything. And in this country where democracy is supposed to be celebrated, yesterday was not a good day for democracy.
Yeah, it wasn't. And I remember LinkedIn, and it's so interesting because we're talking about this conversation, and this is a wealth event, but I don't feel like as Americans we cannot talk about this anymore. And I was on LinkedIn, and a guy had showed a picture, an ice sculpture of George Floyd. And for those of you guys who don't know, I kind of went straight into it. We went straight into the conversation. So I didn't introduce myself or anything. I'm so sorry. My name's Saria, and I am the creator of the Black Wealth Matters series, but I also have a team, and together we all put it on. And so my team includes Kathy Flores, who's actually tech with me today. It includes Jamie Haile, and she is also a form of our tech today. Fabiana Downer, who's amazing and from St. Lucia, the island. She identifies with you, Dr. K, because of that island contact. Yeah. And Gil Aguilar, and also Kenneth Gray. So that's the team that put together this event. And what I love about the team that put together this event is out of that team, I am the only Black person. So for me, what that shows is this Black wealth conversation is an American conversation where we all need to understand what's going on because it's part of America. Now, the other thing that that I wanted to touch on when we were talking about what were you talking about a second ago? And you can mute yourself. If you need to do something, don't be afraid to mute yourself. Okay. And the reason why we ultimately did this, I was bringing up George Floyd and how George Floyd had this ice sculptor, and George Floyd is the catalyst for this event for me, because when George Floyd was murdered, I really just had to take a real honest look at the financial sector, because I always think, Dr. Maggie, I always think that money solves everything, right? If you have money, you're fine. But when George Floyd was murdered, I was like, as a people, we have money. As a people, we have money. So what else is there? And I really started looking back in history and just reading everything from books around the Federal Reserve Bank forming to books right after Reconstruction, when Teddy Roosevelt was the president, to the first bank, the first 6 Black millionaires out of slavery. And what I realized was that systemic racism, they say the trick of the devil is convincing you that it doesn't exist. And systemic racism has become that devil that has convinced some people that it doesn't exist. And unfortunately, some of those people are Black people. And because it convinced us that it doesn't exist, we don't know what we're fighting. And when you go deeper into the conversation, you start to see that it manifests in so many areas, not just money, not just crime against our poor. And if you want to be super duper honest, systemic racism is bedfellows with poverty, right? Its aim is to keep us poor as a people. And that's why this wealth conversation is so important. So it's not enough for us to just focus on money. We have to focus on politics. Politics and money actually go hand in hand. If there was a race, they are equal. Politics is just as powerful as money in America. The environment, medicine, health, our mental health. One of the things I had to tell my boss today is I have to limit who I listen to, even from a company perspective, because in my mind, if you're silent, you're violent to me, and I don't want to have any conversations. I don't even want to be on the receiving end of a conversation from you. That's for me, right? So that's how it's showing up for me right now. So, and so Dr. Maggie, I had the pleasure of being referred to her by one of my clients because Dr. Maggie is, when I told him what I was doing, he was like, Dr. Maggie, she's been on this path already. She's such an advocate, and she really has been studying Black lives and all of that. So I wanted to have that conversation with you. So that's where this conversation comes from, you guys. Well, I was just going and George Floyd, I was on LinkedIn, and there was this conversation, and people were so quick to call him a criminal and say that he deserved to die. And what I was asking those same people, because I'm ultra petty sometimes, is that now that we have all of those people that were climbing the wall, are they too criminals? And what punishment do they deserve? Since you're so good at doling out punishment, what do they deserve? So that's my thing right now. If we're I want equality. Equality means if we do the same punishment, we get the same crime, period. So that's what I was thinking. And right now, I don't know where the lines cross or merge anymore. I really don't. I don't know where professional and social justice, I don't know anymore. What about you?
No, I agree. I think, one of the first things as a parent, you teach your child is that you're accountable for your actions and your words. And, yesterday's debacle is really a perfect example of this. Are these individuals going to be held accountable for their actions, just as other people in other communities have been held accountable for their actions? And sometimes they've been threatened and hurt without doing anything, or just simply protesting, or simply being around at the wrong place. So I think that is the question. No one is above the law. No one is above, morality or ethical practices. It goes from the top of the nation to, and dispersed everywhere. So I think for me, that is the question to see. I think this is a moment in time where things can shift, because if you do allow one group to get away with something that another group couldn't get away with, you are sending the wrong message, and this will only continue, and the racial divide will continue. And I think it will be very hard to heal as a nation. So I am really curious to see as a whole, whether you're political, non-political, just as a human race, whether we can come together and really decide, whether people are going to be held accountable for their actions. And then that's the message you want to send to your children as well, because everyone has a responsibility to listen to each other, to be empathetic, to be compassionate, to treat each other equally, and to listen to each other. And if we can't do that, then there's no hope for us advancing as a nation and as a race.
And my fear, Dr. Maggie, is number one, you were saying that people have been at the wrong place at the wrong time. The problem with being Black is the place and time.
Yes.
Being Black makes you at the wrong place at the wrong time. It's just that, right? And I don't know. And I'm still searching for this answer myself, real talk. I don't know if America is really interested in the conversation or the healing that you're talking about. But what I do know is if we put our heads down and we keep moving and keep doing exactly what we're doing the protesting, we're doing the running, we're doing the organizing, and then we do this stuff that we're doing, where we're talking to people, and you're going to give us all these amazing gems about what we need to do in terms of health, because it's heartbreaking when we're out there fighting our butts off and our grandparents go to the hospital for COVID and never come out, or our blah, blah, blah has hypertension that led to X, Y, and Z. And now they're missing a foot, so all of that adds to the pot too, because that's just another tentacle of systemic racism.
Absolutely.
Yeah.
Absolutely.
And you can go straight into the conversation too. I'm ready. And I'll add as I want, you guys, Dr. Maggie and I, we had a great conversation. I'm so excited for you guys to hear from her. She's just as beautiful on the inside as she is on the outside. Yeah. And we're going to, so if I listen like a kid from the South Side of Chicago. So, so where I hear things, I'll make sure, we all get clarity. If I don't understand it, that means you guys probably don't understand it, but I am looking at the chat. Okay.
Okay.
So
I'll introduce myself so people know what my background is. So I'm Dr. Maggie Cadet. My full name is Magdalena. My parents are Haitian, so they immigrated into this country right before I was born, and they came here with the hope of providing me with a life of opportunity and equality. That was their hope, and that's something we've been speaking about a lot lately. And my dad was, he just retired as a physician. He came into this country and had to redo some of his training in obstetrics gynecology. So that's where I had my first inspiration. I've always been surrounded by people in my family. I've been very fortunate who have been in the medical field or health related field. And so I always knew I could become a doctor. And that's not the case for so many people in this country, especially minorities. It's a problem not having role models or enough role models as Black physicians. Currently, Black physicians make up 2% in terms of female physicians make up 2% of the physician population, which I was astounded to hear actually this year when I was doing my research. So growing up, I thought I was going to be a pediatrician because I had an amazing, again, minority pediatrician. And I said, I love kids and I want to do that. And so from a very young age, I always knew I wanted to do something in medicine. I loved healing. I loved working with people. I always thought that if I could make their life better in any capacity, whether it was physically or mentally, emotionally, that I was doing my job. And over time, I came across rheumatology, which is a field dealing with autoimmune system diseases as well as musculoskeletal health. So arthritis, wear and tear arthritis, or inflammatory arthritis like rheumatoid arthritis, chronic pain. This is something that I fell into because I met a young female in her 20s while I was in medical school. She was African American. She was diagnosed with lupus, which is an autoimmune disease that can affect any organ system in the body. And if not treated, it can really lead to bad complications like heart disease, kidney disease, and even death. And when I met her, I don't feel like she really understood exactly how complicated her disease was. And honestly, as a medical student, I didn't really understand either. But I always remembered her telling me that her doctors weren't communicating with her. She didn't want to be on certain medications because obviously they would, maybe disrupt her appearance. And again, I don't feel like she really understood the complexity of her disease, but she also didn't find that physician that really helped her. And she ended up passing away from lupus at a really young age. And I remember looking at her and thinking, this could be me. And over time, I decided that I wanted to go into this field because I saw so many young African-American individuals, specifically females, who were affected by autoimmune diseases. And I felt that I could at least make a difference, whether it was just talking to them about their disease or finding out if they had the disease versus something else. And I wanted to become more involved in a national educational platform to educate people about autoimmune diseases. And as my path this year has gone on, I realized all this other medical conditions like diabetes and hypertension, heart disease, obesity, mental health, postpartum depression, maternal complications, they all tie into the immune system. And also I felt that I could be a voice for minority populations. So that's my story. Now, I know in the last year, many of us have really struggled with the fact that COVID-19 has affected so many minority populations in this country. And we know now that most African-American, Black communities, brown communities, and other minorities like Hispanics and Asians, they are also at risk for complications from COVID-19. And one of the reasons why is because they have underlying conditions such as hypertension, lung disease like asthma, COPD, which is chronic obstructive pulmonary disease, emphysema. They may have cancer, malignancy, which also is an immunosuppressive state. They have, they're elderly, they're more suppressed. All of these underlying conditions put people at risk for COVID complications. And we now all know COVID complications can go from loss of taste and smell, it can go into blood clots, it can go into brain fog or disruption of mental clarity. These are all the conditions that our African American, brown, and Black communities are being affected with. And that's why I am urging people to really take control of their life. I know it's not them alone because they're going to have to work with their physicians, but some African Americans and Black communities are distrustful of the medical system because of inherent racism. And so I am urging them to, again, wear masks, hand wash often, frequently, social distance. If you're in a household that is not your own, wear a mask indoors. And also take precaution. Do not go out if you don't have to. I do understand the essential workers. There's a large Black and brown community population that do make up the essential workers. So they do have to go to work. But again, they have to be as safe as possible. And if it means needing protective gear, as mask or face shield, they have to demand it, because if they don't demand it, then they're putting themselves at risk on a day-to-day basis. So that is with COVID-19. Now, going forward, we now have a vaccine. And I actually received my vaccine yesterday. And I have to say, there are studies showing that, Hispanics and Caucasian individuals, I think there was a study recently where over 60% would get the vaccine if presented with the opportunity. And in the Black population, it was lower at 43%. And why is that? Well, there's been mistrust, as I said, in the healthcare system because of inherent racism. And where does this come from? Well, some of you, and I was reading more and more about this. In 1932, there was a Tuskegee Experiment. I'm going to just touch on my notes because I really want people to know about this. And it was conducted by the U.S. Public Health Service. And there, at the time, there were 600 Black men enrolled in the study. They didn't know that they were actually part of the study. They knew they were being treated for a condition or some kind of blood condition. And these men had syphilis. 399 of them had syphilis. And basically, the researchers wanted to observe these men as their syphilis progressed, and they were not treated with penicillin or the medication, even though it was available in 1947. These men were continued to be studied because they wanted to see the effects of untreated syphilis. And some of these complications ended up in blindness, mental health issues, and even death. And it wasn't until later, many years later on, there was a person who reviewed the studies in U.S. Public health reports and reported this and leaked this out to a reporter. And finally, in 1997,
Dr. Maggie, let's break that down a little bit. So because I think there's misinformation around that, because I thought they were injected with syphilis. You're saying they already had syphilis.
They had syphilis, right?
Okay.
And they were told, though, that they were being treated for some kind of, a disorder, a blood disorder, right? Okay. But the men, obviously there was no informed consent at the time. There were no other, they weren't being given actual medication. They were being given placebo or other, they were told they were being given something else. And initially there wasn't a treatment for syphilis when the study did begin in 1932, but eventually in 1947, I believe, yes, there was a treatment, penicillin, that emerged, but still the men were not treated with it.
Okay. And my question is, what department of the government allowed that? Because it always has to get signed off on by somebody.
So it was the U.S. Public Health Service. It was a study, and it was done at the Tuskegee Institute. And this was done in Alabama in Macon County.
Mm-hmm. Macomb County. I'm just kidding.
I hope I said that right. I'm sorry. I apologize if I didn't.
I don't know. I just put a country accent on it. But all right. That's
but the disturbing fact, again, is, the men were not given the treatment, because syphilis can be treated. And they were not given the treatment when the treatment became available in 1947. And so I believe the last person, living participant, passed away in 2004, I believe. And so obviously not long ago, and obviously there's a breach of ethics, morality, and later on, obviously, after President Clinton actually issued a national apology at that point. And since then, obviously, research guidelines have been instituted. But that was one of the major experiments and evidence why most of the Black community have such, mistrust in the government. Research studies, we do know that even with the COVID-19 vaccine trials, even though they wanted to enroll Black individual participants, it was at a much lower level than anticipated because of this mistrust. And now, obviously, getting the vaccine, that has played a role as well. And so I understand, when I went into the hospital yesterday, there was this part of me that was really worried. But I do know that, I know that again, it's just with any new drug, you're going to be worried. But I did want I do believe in science, and I do believe that, the clinical trials have been done. There's been an independent board that has reviewed it. Obviously, the FDA has reviewed it. And so I'm doing my part to encourage people, especially in our community, to get vaccinated, because the alternative is getting a complication, being on an intubator, ventilator, getting intubated or a breathing tube down to help you breathe, and other complications in the Black community that, honestly, it's very unpredictable what the effects are. So I
So
do want to show my support for science as well, but I do understand where the mistrust comes from.
And how can we minimize it, Dr. Maggie? Because, and we have some questions coming in the chat about the sterilization of Black women. So I do want you to, if you know anything about that, we can go from there. And if not, we'll table it. And maybe I'll have to do one just about women's health. But my question is, what can we do to make sure that we're getting the vaccine and not placebo? Because honestly, I'm from the south side of Chicago, and I do feel as if there are places in Chicago where they will send that medicine to and replace it with sugar water. I don't know that for a fact. That's my theory. It might not be true. It probably isn't true. But for people that are paranoid like me, what do we do?
No, and again, I understand the paranoia or the mistrust. It's a long history, and I absolutely do understand. I will say that, there are university hospitals, teaching hospitals that will be offering the vaccine. There are, obviously sites like CVS, Walgreens, other pharmacies that are well known all around the country that are available to everybody that will be offering the vaccine. Again, the rollout will depend on the guidelines, put out by the CDC and, obviously the national guidelines, but there are places where you can get the vaccine, and there is a process. So when I went in to get my vaccine, I had to fill out a process about allergies, my, like medical history, COVID questions. And there were, nurses around there to monitor me for allergic reactions. So there are protocols in place. There were stories of, obviously some physicians being asked by people to get the vaccine early for money. So, there are things that are being in place. I think you can rest assured if you go to any pharmacy, teaching hospital, practice, Kaiser Permanente or any other group practice, you will get the vaccine, and you can see the lot number, take down the lot number, know everything about, know everything about your vaccine. This is something that's being injected in your body. And, even as a physician, I was 100% proactive about asking questions. Because if you don't ask a question, you're not going to get an answer, or you're not going to be able to protest if you don't want to get it. So you have to ask.
Yeah.
But there are teaching hospitals everywhere in this country. So they have clinics. You can go to their clinics as well.
Okay, got it. So what I'm hearing you say is that places like CVS and Walgreens, they have the vaccines there. And what might be a good idea is if you live in a neighborhood that you think is not going to be respected for the medicine, go to a different neighborhood and
Absolutely.
get it there.
You can get it anywhere. Exactly. There is, to my knowledge right now, I don't feel like there is a restriction as long as you meet the guidelines for the rollout. There are essential workers now, nursing home residents who, healthcare practitioners who are being offered this first, but eventually the guidelines will roll out. I don't know right now, honestly, if all the pharmacies are carrying it currently, but they are going to be distributing it. So again, contacting your primary care doctor. If you don't feel comfortable with your primary care doctor, you have the choice to find another one. Contact your insurance company. They have lists of doctors, for everywhere. Do the research on your primary care doctor. Speak to your primary care doctor first and arrange a meeting. I have a lot of patients who do that with me. They come in and sometimes it's just meeting the doctor. So, again, do your research, find someone that you're comfortable with. But again, I am a scientist. I do believe most physicians are here to help people. And I do know that for the Black community, Black physicians really do understand the need to have people that look like you, that can understand your fear, that can understand the bias that does exist. So it's important that you find representation in yourself in the healthcare field. Okay. That's the one thing I've heard from many patients when I walk into a room. They do, they don't really know anything about me, but the fact that they feel like I can understand, how they're feeling. And also too, I can help them dispel myths, right? Because there are myths out there and misinformation. So it is important to find someone who is going to be honest with you, practice on evidence-based medicine. So that's the other thing that's important. It's not just what do you feel like. There has to be the evidence. And honestly, currently right now, that's why I ended up, taking the vaccine, because the trials have shown the effectiveness, and, we'll wait and see.
Yes, we'll wait and see. All right. I think we're good. Someone was saying vaccine connections and autism. That's just, what do you think about that?
Currently, there isn't like any evidence that really supports that. Okay. So again, anecdotally, everyone has a different experience. I can't speak to everyone's experience. Got it. But I do know that in general, vaccines do save lives, like, measles, mumps in young children, adults. And so I do believe in vaccines.
I believe in it too. I just believe that we need to get the same ones everybody else gets.
Absolutely.
Yeah.
There should not even be a question about that.
But yet there is.
I know. But again, it's history, right? So I do understand it. And that's why it's important to, again, even with any study, doctors can go over the studies. The study information is out there too. So it really, and again, it might be a little hard to decipher the information because it is in scientific terms, but that is your chance to go to the doctor and sit down and speak to them about, what does this mean? Is this statistically significant? If someone has a side effect, does that mean that I will get the side effect? Every individual person is so different. Everyone has different medical history. So I always say not one person is the same. Even if you're treating someone for high blood pressure, that it's very different, in a 28-year-old, Black female versus like a, 40-year-old Caucasian male, or different medications are used. Some people are resistant to blood pressure medications. Maybe that person has diabetes. Maybe that person, eats a lot of salt. Everyone is different. Just because you have the same diagnosis, it's not one treatment for all.
Got it. Another thing that somebody was asking is Mercury and Vaccine. Is that a thing?
To my knowledge, I can't really speak too much into that. But again, right now, I can't say yes.
Okay, got it. All right. Now, so that's the vaccine. We all need to get the vaccine. Basically, we need to do our due diligence. And if you don't have a hospital or a doctor, she was saying the teaching schools are good in the clinics. So just make sure you're just putting a little legwork in so that get it from a place that you feel like they're going to take care of their people. Now, anything else in regards to COVID? What about if our family members already have it? What can we do then, or anything to prevent it?
So if family members have it, they can donate plasma. There is a convalescent plasma because they may have the antibodies. So that's something that they may want to look into because, again, maybe a family member can benefit from that. I'm just telling people, honestly, to stay put and not go anywhere. I think until we learn more about this, I know it's a sacrifice. And honestly, I have spoken a lot about this. I'm amazed at, I guess, I know this is a sacrifice we have to make. And I know, trust me, it's been a long year for everyone, parents, healthcare practitioners, essential workers, everyone. I know it might be boring. I know people want to hug their loved ones. They want to socialize. Mentally, it's good. But right now, especially because of the surge, and we have a new variant, you have to stay put. And people, the best thing we can do, Dr. Anthony Fauci has said it, and the Surgeon General has said it, and everyone, all the scientists have said it. You have to wear a mask. It's very hard when you're getting together, in groups where that person is not in your household, and you don't know where they've been, you have to wear a mask. And I just say, just, stay with your household. You don't need, do everything virtually. Don't go out right now if you don't really need to go out. If you can, shop online for groceries, do that for now. Sacrifice the travel. I know it's very hard, but I am amazed at how many people, again, like traveled for
the
holidays. And, obviously we're coming, we weren't even over the surge for Thanksgiving. Now we're probably going to see the surge for New Year's and Christmas. And if people would just hold on a little bit, get back, at least hopefully most of the majority of the population will get vaccinated. I do think things will get better. But if the surge becomes too much before people get vaccinated, then we're kind of back to where we were. And we still have to, even if you get vaccinated, you still have to continue the practices.
Absolutely.
Because viruses mutate too. Yeah. So we're seeing that now. The viruses mutate. So again, we want to make sure even though we do have a vaccine, that we are continuing these practices.
Yeah, no, I get that.
The other thing I want to say too is, again, we know that underlying conditions in Black communities is a huge problem. And the diabetes, the hypertension, the lung disease, you have to control those underlying conditions. And maybe this is the time where people really do get serious. Obesity, it really is the time, I think now, if you're going to make a life change, to do it now while, we are under lockdown. Make that change, commit to a healthier lifestyle. I know it's easier said than done. And people sometimes, some of my patients look at me and they say, oh, you're thin. And how do you know how I'm feeling? But growing up, I came from a Caribbean background. I was not eating the best way. I had to make a lifestyle change for myself. My father had diabetes. I looked at him. Again, I know I don't want to get diabetes. I have to make the lifestyle change. And I'm not saying I'm perfect, because I certainly am not. I ate cookies and sweets during the holidays. But as a whole, you have to really control those underlying factors, because those factors they're what's killing the Black community when they're susceptible to COVID, and without COVID as well.
Got it. Now, I'm just laughing because you said you ate cookies and sweets during the holidays. I was like, I just had some cake.
I know. You're allowed to cheat, but, it's very...
If by cheat you mean create a lifestyle of eating sweets, yes, I do cheat. So my question...
Just being active, again, it takes, it's just simple, small steps, being active, making the right choices. And I grew up, again, going to like the hair salon with my mom and, still go there. And, and I actually use that opportunity sometimes to like, talk to like the fellow women who are there. And, they may not be making the best lifestyle choices, all the time. And I know it's difficult because, talk about wealth and, poverty. We're not all, we don't all grow up the same way. And some people have certain access to things that other people don't. And obviously organic foods and other group produce can be expensive. And I understand that. And fast food can be very cheap. And so I do understand that as well, that sometimes people have to make that choice. But I'm hoping at some point, as a community and as, the federal government will give more money, give more funding to help the community, in terms of nutrition services, allocating, maybe more healthier foods to food banks, just really giving funding to research and preventive health services so that, the Black community and brown communities do have access to better food services and nutrition services, as well as exercise programs.
Good. I want to, someone asked about asthma and COVID, and then I want you to go into, I love the solutions that you were saying yesterday, because it sounds like at the end of the day, we just really need more Black doctors. We need more Black doctors. And we
Yes.
both know poverty contributes to why we don't have enough Black doctors. So can you talk about that and asthma and COVID? And then we also wanted to have, well, actually, Jonathan, we're going to have mental health next month. We have a psychologist who's going to only talk about mental health. So you'll jump into that one. But yeah, give us a little idea about this COVID and asthma.
Yeah. So again, asthma has been seen in the Black community, and it's an underlying lung disease. Obviously, there's inflammation in the airways, and it can cause something called bronchospasm or spasm of the airways. And the reason why that's so important in terms of an underlying condition for COVID is we all know that there are patients or individuals who get COVID pneumonia. And if if you have an underlying lung disease, whether it's asthma or emphysema, your lungs are more likely to obviously be inflamed. And then again, there might be a better or increased chance of being intubated or being on the ventilator. So again, if you do have asthma, I would be very cautious. Make sure you have your inhaler. But most importantly, just stay put, to be quite honest. But that is one of the conditions I am seeing where people are, obviously having complications with COVID pneumonia. And then there's also things called the long haul symptoms. So we also know that there are patients who do fine, who, contract COVID and they do get better. Again, the Black community and brown communities, minorities, are more susceptible to the complications. And we do know that with these long haul complications, right now we're seeing longer term lung disease that continues. So even after the infection, months later on, we are seeing people with shortness of breath still, difficulty breathing. Sometimes they have findings on their lungs. So again, I would be careful. And also smoking. I know our colleague spoke about, environmental pathogens. Smoking is huge, whether it's firsthand smoking or secondhand smoking. It's something that I tell every one of my patients don't ever get involved in because it really is. I mean, there's no good that comes from it. Yes, it may be stressful. And I do know a lot of patients have started smoking during the pandemic because they're, stressed out. But that's not the way to cope with stress. It really, it causes so many things. And it even causes some autoimmune, obviously I'm a rheumatologist. There are associations with smoking causing or producing antibodies that have been seen with rheumatoid arthritis and other diseases. So yes, if you have asthma, just be, again, just to be cautious. Don't expose yourself unnecessarily if you don't need to. Get the flu shot. That's the other thing. The flu also can have complications, and we are deep in flu season. So again, I know that a lot of people don't like the flu shot. I've gotten the flu vaccine. I think it's important to get it because that can also have complications. But I do know you asked me about, what is the status in healthcare in terms of minority physicians? Well, I do know that Elizabeth Blackwell was the first African-American female physician in 1849, and she graduated from Geneva Medical School. And the first African-American or physician of color male was James McCune Smith, and he went to Glasgow, medical school in Glasgow. So it's amazing to see that these pioneers, were the first in our field. Now, what I think we need to do is continue increasing the population of minority physicians because we are needed, whether it's in urban areas, there's places in the Midwest, other rural areas that do not have a minority physician, and there's a large minority population. The problem is because, as you mentioned, with financial, stability, going to medical school is a huge financial sacrifice. People come out over $200,000 in debt, and sometimes that is a deterrent for people who want to become doctors, but they feel that they're not able to sustain a good lifestyle after they've gone to school and residency and training. So I do believe it is important for these medical organizations and the AMC and other organizations to increase funding to medical schools, especially historically Black medical schools like Meharry Medical College, Howard, Morehouse, amazing medical schools who have such amazing potential, and you don't want to let these individuals not pursue their dream because of financial reasons. And also, the more you have role models in medical school, the more likely women and males of color will go on to becoming physicians. I know that one of the reasons why I went to Drexel University College of Medicine, and one of the reasons why I picked that school was because my class had a large number of minority individuals going through the program. And I felt so supported and invigorated during my time there that I felt I could achieve it. Do I wish there were more role models while I was working in the hospital? Yes. And I think that's one of the reasons why I did a women's health pathway, and I wanted to become a mentor for other, especially female physicians, but, males too. It is important to see someone that looks like you, to know that you're able to achieve that dream, but also know that you can be supported, because there is inherent racism in the medical field, not only from a patient perspective, but also a physician perspective. And it's not easy to climb the ladder and achieve positions of leadership. So it is important to have mentorship.
Yeah, I heard a story about one of my clients was telling me how the nurses at her hospital out here in LA, very rarely does a doctor fire a nurse, she said, but the ones that are fired are usually Black women. And it's usually a certain ethnic, she said it's usually Armenian men firing their Black nurses. There's somewhere in that, there's a butting of the hits in that particular group. But I thought that was so interesting. She said very rarely do they get fired. So obviously there's prejudice there. And then one of the things that I want you to do is just, I'm going to say one thing, and then I would love for you to wrap it up for us. And then I'll add my little piece, and you can add whatever you want. But I think in terms of mentorship, the reality is there are so many kids that need mentorship, and it's almost like people in certain positions, whether it's finance or medicine, tech, it's almost like we need to have a monthly mentor meeting with a round table of kids and delegate responsibility and have 30 kids in a group. We need to really embody I am my sister's and I am my brother's keeper a lot more than what we're doing.
Absolutely. I do believe that the events from the last year, again, we kind of knew things, and I will be completely honest, I didn't notice as much, or I don't think I took stock in the need for, again, mentorship and seeing someone else that looks like you in the past. And it wasn't really until last year that it really woke me up. Again, I see all these children, like you say, that they have so much potential, and they just want to be supported and encouraged. And even if they, don't have the resources, to know that someone else might help guide them. And so I've taken a role too in education and mentorship, working with diversity, equity, and inclusion committees for lower school, because I do feel it's so important at that young age to see someone. If I didn't have my father or my, my other family members who were already doing it, and so it never crossed my mind that I couldn't do it because I knew that they did it. My story might be completely different, because again, it is dependent upon yourself, of course, but if you don't have the resources or if you don't have the guidance, it really depends on who you come encounter with, who you encounter. And I agree. I think in the last year, we are more aware the importance of mentorship. We can't wait till you're older. It really has to start in like preschool, elementary school. And yes, we should be doing more. We should be contacting more frequently. There's so many organizations like Black Girls Rock and, so many organizations. I used to ice skate, and I was literally one of the one of the few African American females who ice skated. And I remember looking at Debbie Thomas at the time, who skated. Yeah. She went to the Olympics. And because I saw her, again, it never occurred to me that I couldn't do it. And she became a doctor. I mean, she has a different story. Her story ended up differently. But again, without having that vision of seeing someone who looked like me, who knows if I would have pursued that passion.
Yeah, that's awesome. I love that. Now, what would you like to leave us with for 2021? So the main thing is we need to support more doctors. And what I see is a amazing doctor like yourself creating a group of kids that they mentor, maybe even putting together your own scholarship and doing your own outreach, because people do want to contribute. We just don't know where to do it. And I hear Melinda Gates gave away $40 billion. And I'm like, but I walk over homeless people. So where did that go? It's like, I almost feel like when I want to give money, I put it directly in the hand of the person I want to give it to, because otherwise I just don't know where it goes anymore. So I would trust someone like you and all of our friends and people, like that, doing a program and giving that money to those kids. I would definitely trust that.
I agree. I'm actually doing work with my old medical school. And that was one of the things that we spoke about, because you're right. People want to give to someone or something that they really believe in and know that that person is going to really appreciate and treasure the resource. And so I agree with you. I think in the next couple of years, I would love to, gather anyone, who would support, since I'm a physician and we're doing health today, to really help students of color in their journey in medical school, whether it's financial, whether it's meeting with them every month, introducing them to other physicians, other colleagues, also having them know that you don't have to be just, you don't have to be a doctor only. You could go into other health related fields, pharmaceuticals. Maybe they become one of the researchers on these trials and recruit Black participants, almost like Stacey Abrams in the political world.
Yes.
She literally went in and got people to vote. We need Black scientists and researchers to get people to participate in trials. So that way we have medicines that work for us. And, to tie in with the wealth, after this past year, I realized, I posted about this yesterday. For me, Black wealth, financial stability is important. But if you don't have your health, there really isn't any way you're going to achieve wealth, because if you're not alive to really carry on your purpose and to, fight for things that you want, then there's no path forward. So it is important to take care of your health, be active, know your numbers. I know we didn't get into this time, but it's like, know your blood pressure, know your cholesterol, know your hemoglobin A1C, which is your diabetes, assessment number. Know your waist circumference, because that central obesity can correlate with heart disease. These are the numbers you need to know, because that will translate into a healthier life. And hopefully you'll be healthy enough to pursue economic wealth.
Awesome. Thank you so much. Any last questions? So you guys follow Dr. Maggie on Instagram, because one of the things that she and I were talking about, and it's something that occurs, the more involved we get in our careers, the less exposure we have to everyday people. So it defeats the purpose of us to have all of this amazing information and be in our bubble where everybody has the same information. So follow her on Instagram. And when she starts promoting that she's looking for interns or any of that, if you have any health questions, ask her. We're trying to do all of that. there are some thank yous coming too. So
Thank you, everyone. And if there's things that you want me to talk about, and I usually post educational,
very
obviously
educational
things, but also again, I'm posting about, again, Black Lives Matters, like really important issues politically and culturally to me as well. So stay tuned for more.
Yes, no, I love your post. It's like it's amazing, you guys. Follow her. She's wealth of information. She's so generous. So and even though we're talking about Black lives, you guys obviously know she's a person and she'll help whoever wants to. So we don't have to say that.
I love everyone.
Yeah. You know, Black doesn't mean X anti anyone else. Exactly. So thank you. Everyone's saying thank you. Thank you. Yes. Follow
Happy New Year.
Whenever she's ready to start doing some sort of scholarship for some kids, we are ready. And, you know, we'll figure it out.
Figure it out. Thank you, Surya.
Thank you. And I'm going to talk about some money, so you can always just listen in and turn off your camera if you want. Okay.
Okay. All right. Thank you.
Okay. All right. Let me see how I do this. I will minimize this, and then I would maximize that. So you guys, that was amazing. And the information that she shared is very advanced. Raquel wants to know, would there be a part 2 to talk about rheumatology? The next series that we're going to be doing is 9 times out of 10. We're still working on it, but I really want to attack the policing conversation. I think that's really what we all need to understand more of, is how this policing stuff works and what we need to do to get a better grasp on that, because that's something. So these conversations, I do realize they scratch the surface, and they scratch the surface of what we do as well. And speaking of what we do, so Kathy, I'm going to kind of play it by ear today, but I'll tell you when to switch the thing. So you guys, I want to talk a little bit about what I do as a financial professional. So thank you guys for hanging out with us. And let me see. Okay, perfect. So I've been really thinking about this lately. And one of the things that I've been realizing and that I like to share is in the Black community, and it might be in other communities too, I only know from the Black world, but in the Black community, I consider there to be 2 types of people. There are the people that hold up the umbrellas, and then there are the people that we put under the umbrellas, right? And so for me, so when I'm holding up my umbrella, the people that I'm wanting to put under my umbrella is my mom, my sister, my brothers, and you know, pretty much that's it for now, my immediate family. And you might want to put your cousins, your nieces and nephews. Everybody has different people that they want to put under the umbrella. The problem is that sometimes our umbrella isn't big enough, right? And because it's not big enough, we can't really shelter anyone. We can't really protect anyone. So the purpose of this conversation that we're going to scratch on today is really to start creating that awareness so that we can really create those steps to make bigger umbrellas. And the goal is that our umbrella becomes big and we connect them. And then next thing you know, instead of it being umbrellas that just protects communities, it becomes a superdome that protects the culture, right? So that's the way that I think. So in terms of what we do, you guys, I'm going to go over what we do, and I'll be fast and effective. So give me about 20 minutes, but I'm definitely going to go over what we do. So in terms of what we do, we really do really 2 things. We help people plan for their future, and then we recruit and train other financial professionals. And just like Dr. Maggie was saying, in terms of there being 2% of African-American female doctors, I didn't get the number for males. There's not even a number for the number of Black financial advisors. There's literally not a number. I couldn't find it. And I couldn't even find the kids that are majoring in it in school. So if if politics and finance are the foundation, what controls America, and we don't have enough people in finance, and it's not just us, it's all people of color. If we don't have enough people in finance, then we're obviously missing opportunities where we can help educate our communities. And I love this quote: "The best way to create the best way to predict your future is to create it." So what I want to create, and I need you guys' help in this, is we want to create more financial professionals, people of color, so that we can help these communities. And then at a certain point, we want to donate to those doctors, and we can help that. And we want to get mentors in the policing world. We need to move faster. All right, Kathy. So I'm going to talk a little bit about the company, how we help people build businesses, and a little bit about our platform. And everyone who registered, we're going to set some time to connect with you guys later. Oh, I could do it here. I forgot I can control my own slides. Thank you, Kathy. I have all the power, you guys. And I want you guys to go to the BWM educational series and follow us on our, Jamie, put up our Instagram as well. Follow us on our Instagram too, you guys, because we give you those links to our speakers. We give you very great information. Our goal is to be a hub for wealth, period. So we want all people and we want all people to build better financial futures. Money is power. So we're looking for people that have certain traits in terms of our business. We're looking for people who like people. We're looking for people with good hearts and integrity. What I love about this BWM series is that it's a socially aware group that comes here. And I think that's the foundation of anybody that I want to be around right now. I want them to be socially aware of what's happening. I can't ignore yesterday and talk about Bitcoin. I can't ignore yesterday and talk about leadership. I cannot. So what I love about our team, and we're going to show you guys commercials, is that we're all so aware. Again, I'm the only African American, but we're all people and we all have amazing empathy. So we're looking for people like that, if you know anyone like that. And in terms of an entrepreneurial mindset, of course, that's important, but that can be learned and taught. I don't think goodness can be taught. So in terms of our exceptional business opportunity, I want you guys to focus on our business system. We have an amazing, effective business platform, a very simple system. I have a degree in finance, but I'm abnormal in this company. And that's awesome, you guys, because as important as finance is, I don't want anybody going to school anymore for something that they don't have to go to school for, and they can get this information from here. Why not? So if you have a bachelor's in finance or MBA, great. But most of you, again, just based on the numbers, most people don't. But what's awesome about right now, the financial sector, which has been closed predominantly to women and people of color historically, it has been. There's been lawsuit after lawsuit, class action suit after class action suit to get people into, like everyday people, into these industries. So we're actually allowing these everyday people to come in here now. And that's a big deal. So please keep that in mind. All right. And then we have powerful compensation, you guys. The financial sector feeds everything. The financial sector feeds politics. It feeds technology. It feeds the movie industry. Finance is the foundation of our capitalistic society, right? So, and then in terms of timing, when you're looking at a business, you have to understand, like, is this great timing? There were people, you guys, who bought businesses in 2017 and COVID wiped it out. Wiped it out. You guys, before COVID, we were at restaurants. Me and my husband used to have date night every Friday night, and we work across the street from a hotel, and we would meet for happy hour. And then sometimes our associates and business partners would come, and there was a hotel with a pool next door. I mean, we would just have the best time. That hotel doors, they're locked. That parking lot is a ghost town. The lights are completely off. And so there were people who invested in things and they got timed out. They got timed out. But what's great about the financial sector is we do better when things are bad, because when things are bad, people have a opportunity to be self-reflective. They get to look at what they did wrong or what they should know and or what they want to create moving forward. And just FYI, you guys, this won't be the last market downturn. This won't be the last something. Last time it wasn't COVID. Last time it was the mortgage industry. This time it's COVID. Next time, I think it will be robots. But that's my theory. I don't know. What's your theory? Let me know what you think the next market downturn will be a result of, because there were documentaries called The Terminator. And in those documentaries, which I believe are true, they were predicting something. I'm just kidding, you guys. All right. And then we got to think about strong core values. In terms of our values, our company, we're just a great place to be. Dr. Maggie was talking about the racism in the medical industry. How miserable is it being somewhere where people are not appreciating you, right? They don't, like, this light doesn't appreciate me. This light just goes off while I'm talking. It's motion activated. So how nice is it to be somewhere where people appreciate you? What type of stress does it create to not only experience racism in the world, but then go to your job and experience it? How much does that age you internally? What type of medical conditions does that create? Right? So we're such a great space for people to be. I get affected enough. Jonathan, who left, he was talking about mental health. I get affected enough by everything out there. And thank God in this company, I feel loved and appreciated. So that's good. Why do we have to deal with anything else? And in terms of it being the right place at the right time, you guys, let's talk about it. Right now, someone was talking about homelessness, like what do homeless people need to do about COVID? And I didn't even want to ask that question to Dr. Maggie, because it's just a big issue. Because first of all, we don't need homeless people. Why can't we fix that, right? But what I can tell you is this. Those homeless people did not grow up in a bubble. They did not birth themselves. They did not come into this world by themselves. They have a family. And at some point in time, someone's umbrella just wasn't big enough to put them under it. Right? So what can we all do to make sure that we're doing the most to support our families, even if it's an extended cousin? Because I think about that. I don't want nobody in my family being exposed. Okay, I'm going to tell you guys a quick story, and then it's a quick story. So I was, when the COVID first happened, I was sitting down in my office parked outside, and you guys, it looked like I Am Legend outside. It literally looked like I am in my mind, there was a tumbleweed across my car. There was not a tumbleweed, but in my mind, there was a tumbleweed. But what did happen was there was a coyote. You guys, I work across the street from a gorgeous hotel. A coyote walked past my car. And this is the scary part. He was going to where the homeless people were. I was like, oh my God, that coyote looks like he knows where he's going. You know, so this conversation of us really being intentional about making money, for me, it's life or death. George Floyd died over $20, you guys. It's life or death. If you have the wherewithal to be in this room and to think about money, you have the wherewithal to push a little harder and create wealth. Okay, so there's a need for it. And these are just all the statistics of that need for it, which I'm sure you guys just read. And most families, they live with a lot of debt, especially Black families and Latino families that are advancing. All of us are trying to advance, right? And because of the way that America has been created and systemic racism plays out and the war on drugs and all of this and all that, a lot of my generation, I'm 44, a lot of my generation, we were the first people in our family to go to college. Did our parents plan for college? Absolutely not. They planned for it, not at all. There were very few times that not even very few, I never even started school with books, right? Because that's how much we didn't have the money for it. So As a result, all of my friends that went to college, we had to take on student loan debt. Black women are the most educated women, most educated group in America. Some people have that money. A lot of us did. Some of us, even though our parents might have been educated, they might have had 5 kids, 4 kids. They couldn't cover everything for everyone, right? So we have debt. We have credit card debt. We have student loan debt. We have home debt. And hopefully this new administration does something about it. But if they don't, it's still a part of our lives. So we want to address that, and we help people plan for it. A lot of people don't have savings because of that debt. And not only that, you guys, but this is another issue affecting the Black community. Our community, we just started becoming entrepreneurs like in the last few years when Obama had all of these great programs that really supported SBA, SBDC, and lending for entrepreneurs. But the reality is, a lot of us are employees, and we're making great money as an employee, but when you start getting taxed as a W-2 versus a business owner, you're paying a lot more. So now our money just went down, and a lot of us are giving our money to our families, to our cousins, to our blah, blah, blah. So we're still making it go down even more. This life is a mess. Okay, so, and then people are afraid, Dr. Maggie was talking about fear in the medical community. You guys, there's so much fear in the financial community. I had a conversation with a financial advisor today out of Texas, and just a beautiful young lady. And she was saying how one guy liquidated his retirement account and put it in a bank. In the bank. He'd rather lose money than make money. There's so much fear, and it's warranted. It's absolutely warranted because, the first bank, the Freedmen's Bank, the owners of the bank, that was the only bank that they were shuffling Black folks to and making it seem like the government backed it, really misrepresented us to us. They had us all putting our money in there. And then the owners of the bank, they were like, whoopsie, we lost it. We don't know what happened. Figure it out. We're poo for you. And they didn't try them. They didn't do anything. And there's just story after story of that happening throughout history. And in some situations and in some communities, banks are just as predatory as the predatory lenders, payday loans and things of that nature. So how do we help with that? We help with that by training people who have good hearts and thinking outside the box. And we're training people in your community. So worst case scenario, if they do something, you know where they live. Going on to what we're already stressed about. But this one, in my opinion, this one we can do something about. Do we get to do the same things that other people do? And then what is wealth? What is wealth? That's such an interesting conversation, especially in the Black community, because during the holiday, I'm sure many of you guys saw celebrities buying their kids $5,000 purses. But what we know is that wealth is something that can be passed on generation to generation, right? We can't pass our kids on our job, but we can pass them. If we owned Amazon, we can pass our kids on Amazon. You guys, our last speaker, Johanna. Johanna was a lawyer in New York. She worked for Chase Bank, but now she's an environmental advocate. But this is the funny thing. Chase Bank was started in the 1800s by the dad of the guy who we know as the Chase Bank owner. And he gave that bank